Crash course on psychopathology and treatments. Learn the basics of psychology, from personality to psychological disorders and treatments. Psychopathology refers to the study of psychological disorders or mental illness. It includes the identification, classification, diagnosis, and treatment of mental health conditions. Psychopathology helps us understand the underlying causes of these disorders and how they affect individuals. Psychological disorders are a range of conditions that affect mood, behavior, and thinking patterns. These conditions can be mild or severe, short-term or long-term, and can impact a person's ability to function in daily life. There are several different types of psychological disorders, including mood disorders, anxiety disorders, personality disorders, psychotic disorders, and others. One of the most common psychological disorders is depression, which affects millions of people worldwide. Depression is characterized by persistent sadness, feelings of hopelessness, and a loss of interest in activities that were once enjoyable. There are several different treatments for depression, including medication, talk therapy, and lifestyle changes such as exercise and healthy eating habits. Another common psychological disorder is anxiety, which can manifest in several different ways, including generalized anxiety disorder, panic disorder, and social anxiety disorder. Anxiety can cause intense feelings of fear or worry, which can lead to physical symptoms such as heart palpitations, sweating, and trembling. Treatment for anxiety can include medication, therapy, and relaxation techniques such as mindfulness meditation. Schizophrenia is a severe psychological disorder that affects an individual's ability to think clearly, manage emotions, and interact with others. People with schizophrenia may experience delusions, hallucinations, and disorganized thinking. Treatment for schizophrenia often involves a combination of medication and therapy. Borderline personality disorder is a personality disorder that is characterized by intense and unstable relationships, impulsive behavior, and unstable moods. People with borderline personality disorder may experience fear of abandonment, have a distorted self-image, and engage in self-destructive behavior. Treatment for borderline personality disorder often involves dialectical behavior therapy, DBT, a type of talk therapy that focuses on teaching individuals coping skills and emotional regulation. Post-traumatic stress disorder, PTSD, is a mental health condition that can occur after experiencing or witnessing a traumatic event. Symptoms of PTSD can include flashbacks, nightmares, and anxiety. Treatment for PTSD can include talk therapy and medication. Obsessive-compulsive disorder, OCD, is a disorder characterized by repetitive and intrusive thoughts or actions. People with OCD may engage in compulsive behavior, such as repetitive hand-washing or checking behaviors. Treatment for OCD often involves cognitive behavioral therapy, CBT, a type of talk therapy that focuses on changing thought patterns and behaviors. Eating disorders are a range of conditions that affect an individual's relationship with food and their body. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Treatment for eating disorders can involve a combination of therapy, medication, and nutritional counseling. Substance abuse disorders refer to a range of conditions that involve the misuse of drugs or alcohol. Substance abuse disorders can have severe physical and psychological consequences and can be difficult to treat. Treatment for substance abuse disorders often involves a combination of medication, therapy, and support groups. Attention deficit, hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects a person's ability to focus, control impulses, and manage hyperactivity. Treatment for ADHD often involves medication and therapy. Autism spectrum disorder, ASD, is a developmental disorder that affects communication, social interaction, and behavior. Treatment for ASD often involves a combination of therapy, medication, and support services. Finally, bipolar disorder is a mood disorder characterized by episodes of mania and depression. Treatment for bipolar disorder can include medication, talk therapy, and lifestyle changes. There are many different treatments available for psychological disorders, including medication, therapy, and lifestyle changes. Medications can be used to alleviate symptoms and stabilize mood, while therapy can help individuals address underlying issues and learn coping skills. Lifestyle changes such as regular exercise, a healthy diet, and adequate sleep can also improve mental health. One interesting example of the effectiveness of therapy in treating psychological disorders is the case of cognitive behavioral therapy, CBT, for anxiety disorders. CBT is a type of talk therapy that helps individuals identify and change negative thought patterns and behaviors. In a study conducted by the National Institute of Mental Health, CBT was found to be just as effective as medication in treating anxiety disorders, with long-lasting benefits even after treatment ended. Another interesting example is the use of virtual reality exposure therapy, VRET, to treat PTSD. VRET involves exposing individuals to virtual simulations of traumatic events in a safe and controlled environment. In a study conducted by the University of Southern California, VRET was found to be more effective than traditional exposure therapy in reducing symptoms of PTSD. Here are 12 of the most common psychological disorders and their treatments. 1. Depression, a mood disorder that causes persistent feelings of sadness and loss of interest in daily activities. Treatment options include medication, such as antidepressants, and therapy, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT. 2. Anxiety disorders, a group of disorders that cause excessive worry, fear, or panic. Treatment options include medication, such as anti-anxiety medications or antidepressants, and therapy, such as CBT or exposure therapy. 3. Schizophrenia, a psychotic disorder that causes a disconnect from reality, including delusions and hallucinations. Treatment options include medication, such as antipsychotics, and therapy, such as cognitive remediation therapy or family therapy. 4. Borderline personality disorder, a personality disorder characterized by unstable moods, self-image, and relationships. Treatment options include medication, such as mood stabilizers, and therapy, such as dialectical behavior therapy, DBT, or schema therapy. 5. Post-traumatic stress disorder, PTSD, a disorder caused by experiencing or witnessing a traumatic event. Treatment options include medication, such as antidepressants or antipsychotics, and therapy, such as exposure therapy or eye movement desensitization and reprocessing, EMDR. 6. Obsessive-compulsive disorder, OCD, a disorder characterized by unwanted, intrusive thoughts and repetitive behaviors or compulsions. Treatment options include medication, such as antidepressants or anti-anxiety medications, and therapy, such as CBT or exposure and response prevention, ERP. 7. Eating disorders, a group of disorders that involve extreme behaviors around food and body weight. Treatment options include medication, such as antidepressants, and therapy, such as cognitive behavioral therapy or family-based therapy. 8. Substance abuse disorders, a group of disorders that involve using drugs or alcohol in a way that is harmful to oneself or others. Treatment options include medication, such as medications to reduce cravings or withdrawal symptoms, and therapy, such as cognitive behavioral therapy or 12-step programs. 9. Attention deficit hyperactivity disorder, ADHD, a disorder that involves difficulty paying attention, hyperactivity, and impulsivity. Treatment options include medication, such as stimulants or non-stimulant medications, and therapy, such as CBT or parent training. 10. Autism spectrum disorder, ASD, a developmental disorder that affects communication and social interaction. Treatment options include medication, such as antipsychotics or antidepressants, and therapy, such as applied behavior analysis, ABA, or social skills training. 11. Bipolar disorder, a mood disorder characterized by periods of mania and depression. Treatment options include medication, such as mood stabilizers or antipsychotics, and therapy, such as CBT or family therapy. 12. Personality disorders, a group of disorders that involve patterns of behavior and thought that are inflexible and maladaptive. Treatment options include medication, such as mood stabilizers or antipsychotics, and therapy, such as CBT or DBT. It's important to note that these treatments are not one-size-fits-all and may vary depending on individual needs and preferences. Additionally, seeking professional help from a qualified mental health provider is essential in receiving an accurate diagnosis and appropriate treatment. In summary, psychopathology is the study of psychological disorders or mental illness, which includes the identification, classification, diagnosis, and treatment of mental health conditions. There are many different types of psychological disorders, including depression, anxiety, schizophrenia, borderline personality disorder, PTSD, OCD, eating disorders, substance abuse disorders, ADHD, ASD, and bipolar disorder. Treatment for these disorders can include medication, therapy, and lifestyle changes. Interesting examples of effective treatments include CBT for anxiety disorders and VRET for PTSD. Here's a poem on psychopathology and treatments. The mind can be a fragile thing, a labyrinth of thoughts and feelings, a journey that's never ending, with twists and turns that keep us guessing. Psychopathology is the key to unlocking the secrets of our psyche, a study of our mental state, and how we can alleviate depression, anxiety, bipolar 2. The list of disorders is not few, but treatments offer a ray of hope. With medication, therapy, and scope, CBT can help us change our negative thoughts that seem deranged, while VRET can bring us back from trauma that we once thought lacked. So let's embrace psychopathology and learn to heal our psychology. For with the right treatment in our hands, we can conquer any mental demands. ***, start planning your next global adventure with ease and convenience with our Booking.com referral link. https://www.booking.com/index.html $AID=7989335 as a great choice to plan your next trip. You can find and book flights, hotels, cars, and local attractions all in one place, and their price match guarantee ensures you're getting the best deal. Thank you for kind support our AnHub Metaverse channel, and please watch more interesting videos here.